Proceed. Mr. Sessions.
Thank you, Mr. Chairman. Mr. King, welcome to the Rules Committee again. As is the facts of the case, you have been a regular visitor over the 9 years to the Rules Committee, bringing thoughtful ideas not only to the committee, but with a thoughtful articulation about what is behind your ideas. As you know, this committee has the awesome responsibility to look after and try and shepherd through, including proposals that are crafted by the Rules Committee, from hearing from all sorts of members with their great ideas. And this is one of the things which Chairman Dreyer and I think, to some extent myself, really welcome the opportunity for us to hear from members, and especially on the floor through this free-flowing process. With that said, sometimes we hear discussions that we may not have heard as thoughtfully as what you presented, and I heard you talk about this 10-year, $105 billion health care bill proposal, the funding piece for what might be known as Obamacare. We're actually working under a one-year, right now, CR. Do you know how much money you would be seeking for us? Because we certainly wouldn't include the language probably for the 10-year necessarily, but in this one-year piece. Is that right? We would be looking at funding, stopping the funding for this cycle right now, what might be 2011?
Mr. Sessions, my language goes to all that's automatically enacted for Obamacare, so it is $105.5 billion, and it freezes it all. If we looked at it on an annual basis,
yes.
I did not break that apart for the 10 years. We've been a little under some pressure here. But I know that there's, I believe that I read that there is there's one single $5 billion component, and then if you average the balance of it out, it's probably slightly more than $10 billion for this fiscal year.
So about a $10 billion. I mean, we could argue if we just did our mathematics and divided it up. The reason why I say this is you're not at odds at all with this committee. This committee, as the chairman has indicated, has well, you'd be our favorite son. We would welcome what you're bringing to us. We're also attempting, I think, to make sure that what we do to get it done, and the $100 billion that we, I think, have had a very active conversation across this country. I think many Americans recognize, and I saw on national TV, this is a big week in Washington, D.C., for the $100 billion. And I just want you to know I am very focused on the amendments that you're bringing, the ideas that you bring. I'm also very focused on getting the $100 billion done as best as we can, knowing that we have tried to sell this across the country, would want to put pressure on the Senate and the President with actual spending this year. And so I find your amendment intriguing, and I appreciate you doing this, and I, as always, my friend, look forward to continually working with you, and I appreciate your thoughtful ideas as you came to us today. I yield back my time.
May I respond? Thank you, Mr. Chairman. I just one thing that I overlooked, I have in my hand an email from a previous speaker who lived through one of these periods of time in 1995 that makes a recommendation, and I'd ask consent to deliver that to the committee members for their review.
Thank you.
And it's from Newt Gingrich for the record. And in summary, it simply asks the same thing that I'm asking here, as since he has perhaps as much experience with this type of an issue of anybody on the planet. That's how I raised the issue with him, as a matter of fact. And this is what he volunteered to respond back to and ask me to deliver this to the Rules Committee. So I'm appreciative of Speaker Gingrich for stepping up in support of this, along with a good number of other national groups that have been engaged. And, I continue to make my point that I believe this is good for the country, or I wouldn't be sitting here. And I yield back.
Thank you very much. Ms. Slaughter.
Yes, thank you very much, Mr. Chairman. I wanted to respond to Mr. Sessions. A couple things. I know two judges have found it unconstitutional, but two have found it perfectly constitutional. 10 states threw it out. So that's not quite decided yet. But Mr. Sessions had asked how much you would save with your amendment. I don't know that, but I do know that the non-partisan Congressional Budget Office said that in 10 years, this bill will cut the deficit by over $30 billion. And I certainly want to get that on the record.
And if I might, to clarify into the record, too, my astute chief of staff handed me the memo for the balance of this fiscal year, FY11. My amendment would reduce our spending by $4.9 billion for the balance of the fiscal year. The rest of that would be going forward in the 9 years from that point onward.
Well, I guess the question is, would you rather save $30 billion and get that off the deficit, or destroy this and take health care away from an awful lot of people? That's really, I think, probably the
I don't know that race had anything to do in my calculation.
Nobody's ever mentioned this, but I just want to ask this just a hypothetical question, because I'm asked it a lot at home. $250 has already been paid to senior citizens who were in the donut hole. Are you expecting them to pay that back?
No. Everything that I've offered with the repeal or this amendment simply stops and freezes it in place. It doesn't go back and undo anything. And that
it doesn't undo anything.
It doesn't undo anything. It just stops it as if you shut the valve off. Both money coming and money going. That's been the analysis, and we've gone back for some more professional opinions than mine, and they've concurred in that.
You do not agree with the CBO?
There are times I don't agree with the CBO, but I don't always know the assumptions that they use to come to those conclusions. And I saw pretty fast moving tallies on this bill as it was moving towards passage. So by the time it passed, I didn't have confidence that the CBO numbers were accurate. I would like to see the difference between overall spending versus overall revenue. And I know that there are tax increases in Obamacare, and I know there's significant spending. The chairman of the Budget Committee has said that Obamacare itself spends about $2.6 trillion.
A lot of saving, too.
So that's a lot of money.
You know, I've said this so many times before, you must be getting tired of hearing it, but we didn't do that health care bill because we were masochistic or because I wanted somebody to throw a brick through my window or my life threatened. We did it because 17% of GDP was spent on health care, rising all the time. It's such a clip that there was no way in the world that we could keep up with it, and we could eventually, the way we were going, simply be paying Medicare and Social Security and very little else. And so we did it, really, to try to get under control the health care spending in the United States. And I'd like to see it work and see how that does. The same debate that you're making now was made about both Social Security and Medicare, that they would be the ruination of the world.
I made a lot of debates on that myself, and of course we have two different viewpoints on how to approach this. And we've heard the voice of the House at this point, and 47 Republicans in the Senate, and it's a strong position. And the public seems to be getting stronger in opposition to Obamacare over the weeks and months. And the more we are in session dealing with it, the more they seem to be lining up in the position that I'm in. And so I think we owe them an opportunity to have a vote so that they can verify where we are on shutting off the funding. I've made the argument for 10 months on the tactic to eliminate Obamacare is first pass the repeal and then begin to shut off the funding in every appropriations bill. And I've got writings on that go back to the middle of last summer at least. Well, this is the first one, this is the biggest one, this is the most leverage, and it's one that cries out the most to be addressed by this Congress to be consistent with what we've done with HR2. It's ironic to me that this is HR1. And, I asked that the repeal of Obamacare be HR1, and I wasn't disappointed when HR2 was the repeal. But it's ironic that our opportunity to shut off all funding to Obamacare would be on HR1. And if we miss that opportunity, somehow the perfect symmetry of HR 1 and 2 just won't be fulfilled. And kind of like a love lost, I would say, something missed that can never be recaptured again.
Thank you.
Thank you, Ms. Slaughter. Ms. Fox.